Welcome back for another deep dive. We got some really interesting research sent our way, and it's on a topic that I think a lot of women are curious about.
Yeah.
It's about aging and how it affects vaginal health.
Right.
So we're going to be focusing on estrogen specifically, and we're drawing from a YouTube video that we found from Dandelion Medical Animation.
Yeah.
And it's called How Can Aging Affect Vagina? Which I thought was a pretty apt title. Yeah, so let's unpack this. So
Sure.
first of all, what is estrogen?
So estrogen is like this tiny little molecule, and it's really powerful.
Okay.
Like it really influences so many changes in a woman's body, and especially in the vagina.
Yeah.
It's like this powerful conductor leading an entire orchestra.
I like that analogy, yeah.
Yeah.
So where does it come from?
So the video mentioned that it primarily comes from the ovaries.
Right.
And think of the like these little factories that are constantly pumping out estrogen,
Right.
especially during a woman's reproductive years. And of course, smaller amounts are produced by the adrenal glands and even the placenta during pregnancy.
Okay.
But what's really fascinating is that estrogen levels aren't like constant.
Right.
They're not static.
Yeah.
They go up and down.
Yeah.
They ebb and flow throughout the menstrual cycle.
Right.
And they actually reach like a peak, a crescendo right around ovulation.
Interesting.
Yeah, it's kind of like a beautifully choreographed dance.
That makes total sense. So it's not just this constant stream. It's more like
It's dynamic.
dynamic. Yeah.
Okay.
I'm in. The video also talked about estrogen and collagen, and I thought that was interesting. So why is that connection so important when we talk about vaginal health?
So this is where it gets really interesting.
Okay.
So you see, collagen is like the building block of our skin.
Okay.
And it provides structure and elasticity
Yeah.
and that youthful plumpness.
Right.
And so it's really like the scaffolding that holds everything together. Now, estrogen plays a really crucial role in collagen production.
Interesting.
So think of it like the foreman on a construction site, like
Yeah.
making sure that the collagen scaffolding is strong and resilient.
Okay.
And that strength and resilience is absolutely vital for having healthy vaginal tissue.
So it's not just about aesthetics, I guess.
Yeah.
It's actually really fundamental to the structure.
It's about the structure of the
Function and the function. Okay.
Yeah.
But as we age, things start to shift, right?
Exactly.
The video was really emphasizing how estrogen production declines as women get older.
Absolutely. As women enter their 40s and 50s,
Yeah.
the ovaries, those once bustling estrogen factories,
Right.
they start to slow down production.
Yeah.
It's just, a natural part of aging.
Sure.
But it has this kind of ripple effect on collagen levels.
Right.
Imagine those construction crews gradually getting smaller and smaller.
Okay.
And as a result, that collagen production decreases and the scaffolding weakens.
So that shift is particularly pronounced during menopause.
Yes, exactly. It's a huge biological transition.
And the video mentioned that women can lose up to 30% of their collagen within the first 5 years of menopause.
Oh, yeah.
Which is...
That's a lot.
Yeah.
That's a dramatic drop in a relatively short period of time.
Right. Yeah. So it makes me wonder what happens to the vagina itself.
Yeah.
So the video focused on the vaginal walls and something called rugae.
The rugae.
Yeah. I don't know if I'm saying that right, but...
You got it.
Okay.
So imagine the rugae as these like delicate folds or wrinkles inside the vagina.
Okay.
They're kind of similar to the pleats in an accordion,
Right.
that allow it to expand and contract.
Yeah.
And they actually play a really important role in vaginal elasticity and lubrication.
Okay.
But as that collagen production decreases,
Yeah.
the vaginal walls start to thin out and they lose their natural resilience.
Right.
And those rugae, those lovely little pleats,
Yeah.
they kind of flatten out,
Right.
and the tissue just becomes less effective at retaining moisture.
So with less collagen, the walls become thinner and drier.
Yeah, that's exactly it.
So I imagine that can lead to a lot of discomfort.
Yeah,
Especially during intercourse.
absolutely.
The video even mentioned pain.
Yeah, it's true. So this dryness and thinning can make the vagina much more prone to irritation.
Right.
And that can lead to pain or discomfort during sex.
Yeah.
And this cluster of symptoms is often associated with a condition called vaginal atrophy.
Okay.
And it affects so many women, especially after menopause.
Right.
Yeah.
Okay.
Yeah. It can be really bothersome,
Yeah.
causing itching and burning.
Right.
And like we were talking about pain during intercourse.
Yeah.
It can even lead to urinary tract issues.
Oh, wow.
Because remember, estrogen supports the health of tissues throughout the pelvic region.
So it's not just the vagina itself.
No, not at all.
Estrogen is impacting the whole...
The whole area.
Okay. So speaking of that, the video also mentioned pelvic floor health.
Right.
What exactly is the pelvic floor, and how does estrogen factor into that?
So the pelvic floor is really remarkable.
Okay.
It's this, network of muscles that act like a supportive hammock, cradling the bladder, uterus, and rectum.
Wow.
And of course, estrogen is essential for maintaining the strength and tone of those muscles.
So I'm guessing when estrogen levels decline, those muscles weaken.
Exactly, yeah.
Okay.
As estrogen production goes down, these muscles can lose their tone and elasticity.
So they're kind of like a hammock that's been stretched out over time.
That's a great way to put it, yeah.
And that can lead to...
Well, several issues, including vaginal prolapse.
They mentioned prolapse in the video, but I didn't really understand what it was.
Okay, so...
Did you explain that a little?
Yeah, so remember we were talking about the pelvic floor muscles acting as that supportive hammock?
Right.
Well, when those muscles weaken, the organs that they're supporting, the bladder, uterus, or rectum, can actually start to descend,
Oh, wow.
putting pressure on the vaginal walls.
Okay.
So it's almost like the hammock sagging so low that the contents start to spill out.
That sounds really uncomfortable.
Yeah, it can be.
And possibly serious.
Yeah, and the video mentioned that multiple vaginal births can make this worse.
Right.
So childbirth, especially multiple vaginal births, can put real strain on the pelvic floor muscles,
Okay.
making them more susceptible to weakening later in life,
Mm-hmm.
especially when you combine that with the natural decline in estrogen.
Right. It's like adding extra weight to an already stretched out hammock.
Exactly.
So weakened pelvic floor muscles can also lead to, what was it?
Stress incontinence.
Stress incontinence, right?
Yeah.
What is that exactly?
So stress incontinence is that involuntary leakage of urine.
Oh.
That happens during activities that put pressure on the bladder, like coughing, sneezing, or even laughing.
Okay.
And it's incredibly common.
Right.
And those weakened pelvic floor muscles are often the culprit.
So the bladder is less supported and more prone to leaks.
Exactly.
Right? When those muscles lose their tone.
Yeah.
Okay, so it seems like estrogen, through its effects on collagen and pelvic floor health, plays a really key role in supporting the whole pelvic region.
Absolutely.
It's like a domino effect.
Yeah.
When estrogen levels go down, it triggers all these changes
It's like a cascade.
that can really impact a woman's quality of life.
You got it.
And while these changes are often associated with menopause,
Right.
it sounds like estrogen is important throughout a woman's life.
Oh, for sure. It plays a vital role throughout the lifespan.
So it's not just about managing symptoms during menopause.
Yeah.
It's about understanding how estrogen impacts our bodies and how we can stay healthy
Absolutely.
at every age.
I agree.
The video also touched on hormone replacement therapy, or HRT.
Right.
Could you talk a little bit more about that?
So HRT can be really helpful for some women,
Okay.
especially those experiencing significant discomfort from estrogen decline. It basically involves supplementing the body with estrogen
Okay.
to replenish those levels.
Okay.
And this can alleviate symptoms and really improve vaginal health.
That sounds promising, but I'm guessing there are risks and side effects too.
You're right to be cautious.
Yeah.
HRT is not a one-size-fits-all solution.
Right.
And it's really important for women to have honest conversations with their doctors
Yeah.
to weigh the benefits against any potential risks.
So it's not a decision to make lightly.
No, definitely not.
It requires a personalized approach.
Exactly, considering individual medical history and risk factors.
So were there any other solutions or management strategies mentioned in the video?
Oh yeah, absolutely.
Okay.
So alongside HRT,
Yeah.
there are other things that can address the discomfort
Okay.
associated with vaginal atrophy and dryness.
Like what?
Well, there are vaginal moisturizers and lubricants.
Okay.
Those can provide significant relief and make intimacy more comfortable.
Right.
Regular exercise can help too, particularly pelvic floor exercises like
Yeah.
Kegels.
Oh, yeah, I've heard of those.
Yeah, they can help strengthen those important muscles.
So it's really a multifaceted approach then.
Yeah,
Lifestyle changes, maybe medical interventions like HRT and over-the-counter products.
exactly.
It seems like having a knowledgeable healthcare provider to guide you is really key.
I couldn't agree more.
Yeah.
You know, finding a healthcare provider you trust and feel comfortable with is so important.
Yeah.
They can help you navigate these changes and address your concerns
Okay.
and come up with a treatment plan that's right for you.
That makes sense. This has been really interesting.
Yeah.
We've learned a lot about estrogen,
We have.
how it impacts vaginal and pelvic floor health.
For sure.
And we've even touched on some potential solutions.
Absolutely.
But I'm wondering, was there anything else in the video that stood out to you?
You know, what really struck me was how the video just scratched the surface of estrogen's impact.
Yeah, it did.
It really did.
Right. It's like we zoomed in on one specific area, vaginal health,
Right.
but estrogen impacts so many other things.
Absolutely.
Like, what else comes to mind?
Well, we could talk about bone health, for example.
Okay.
Estrogen plays a really crucial role in maintaining bone density,
Right.
which is so important for preventing osteoporosis.
Right, which weakens the bones and can lead to fractures.
Exactly.
So as estrogen levels decline,
Yeah.
women are more likely to get osteoporosis.
Exactly. It's like another domino falling.
Right, in this cascade of changes.
Right.
Okay, what else?
Well, there's also the impact on heart health.
Oh, interesting.
You know, it might surprise you, but estrogen actually has a protective effect on the cardiovascular system.
Really?
It helps to keep blood vessels flexible and promotes healthy cholesterol levels.
Wow.
So when estrogen production drops,
Yeah.
a woman's risk of heart disease goes up.
I had no idea estrogen was so important for heart health.
It is. It's pretty amazing.
That is amazing how one hormone can impact so many things.
That's pretty credible, right?
Yeah.
And we haven't even talked about the potential link between estrogen and cognitive function.
Oh, right.
There's more and more evidence suggesting that estrogen plays a role in brain health, influencing things like memory and focus,
Interesting.
and even mood.
Wow.
So some women experience things like brain fog or memory lapses during menopause,
Okay.
and that could be related to those fluctuating hormone levels.
So aging really this complex process
Yeah,
with all these interconnected factors,
absolutely.
and estrogen seems to be right at the center of it all.
It really does. This deep dive has shown us just one small part of a much bigger picture.
Right.
And I think it really highlights the importance of taking a holistic approach to women's health
Yeah.
and recognizing how everything is connected.
That makes sense. It also seems like it's really important for women to have open communication with their healthcare providers.
Oh, absolutely. It's about empowering women with knowledge so they can make informed decisions about their health.
And their well-being.
Exactly, at every stage of life.
This has been such an interesting deep dive.
It has.
We started with a simple YouTube video, and it's really opened up this whole world of estrogen and its role in a woman's body.
It really shows that learning is a lifelong journey.
Right.
There's always something new to discover.
Exactly. And I think the big takeaway is that aging is a natural part of life.
Depth.
And by understanding the changes that come with it,
Yeah,
and by working with our healthcare providers,
exactly.
we can go through this process with confidence.
That's right.
So to our listeners out there, keep exploring, keep asking questions,
Yeah.
and keep prioritizing your health and well-being.
Couldn't have said it better myself.
Until next time, keep those brains buzzing.